Hi, this is Emily Newman with Assignment 6, the case analysis of Virginia Woolf. Virginia Woolf once wrote, "Someone has to die so that the rest of us should value life more." Thinking as a therapist, I think this is an interesting insight into the life of what someone battling depression is thinking. Prior to this assignment, I had read Virginia Woolf's novels and I was not aware of her mental health conditions or her taking her own life at the age of 59. After further researching Virginia's life, her decrease in emotional stability began after her mother passed away at the age of 13 and her sister shortly after. Despite her talented writing abilities, Virginia dealt with depression, mood swings, and suicidal thoughts. Her life is depicted in the movie The Hours, starring Nicole Kidman as Virginia herself. In the movie, it was helpful to see what inner turmoil someone facing a depression or mood disorder lives with on a daily basis. Next, after consulting the DSM-5, my initial diagnosis for Virginia is major depressive disorder with a specifier of recurrent episodes, severe, and psychotic features. The mood in major depressive disorder episode is often described as a person feeling depressed, sad, hopeless, discouraged, or down in the dumps. Also, thoughts of suicidal ideations or suicide attempts are common. They may range from a passive wish not to simply awaken again, or a belief that they feel that they are better off dead. Virginia fits this diagnostic criteria as she is recurrently suicidal throughout the movie. Many bipolar illnesses begin with one or more depressive episodes. While Virginia may appear to have major depressive disorder in the movie The Hours, perhaps if I spent more time examining her whole life and her moods over time, it would be possible for major depressive disorder to turn into bipolar disorder as they have similar symptoms. Possible suicide risk exists at all times during major depressive disorder. Linking this to the movie, it was clear that Virginia was obsessed with the idea of death, both for herself and her characters in her novels. Further exploring the symptoms of the DSM-5, it was evident that Virginia was melancholy, depressed, and had that demeanor at all times. She was reported she spent most of her time secluded in her room or sleeping. In the movie, we see an anxious woman who spends most of her time alone in her room smoking cigarettes, fighting feelings of loneliness and discomfort in her own skin. Another symptom from the DSM-5 criteria of major depressive disorder that Virginia displayed was a significant weight loss and a decrease in appetite. Early on in the movie, her husband chides her for lying about eating breakfast and not following the doctor's orders to eat a healthy breakfast and lunch. The cooks and servants also complain about Virginia being a difficult eater and not partaking in the food that is cooked for her. Lastly, her lack of nutrition is evident when Virginia gets dressed and appears frail and physically unhealthy due to the lack of sustenance and desire to eat. Virginia, as well as other female characters in The Hours, they all showed signs of insomnia, which is lack of being able to sleep. She's shown staying awake late into the night in her writing chair. She looks mentally and physically exhausted. I would also associate that symptom, the opposite of insomnia, hypersomnia, after reading in her biography that she spent 2 consistent months in bed, sleeping, not leaving her room. In the movie, she displayed symptoms as stated in the DSM-5 of fatigue and loss of energy. She never seemed to amount to much in one day. The DSM-5 also states that patients diagnosed with major depressive disorder experience feelings of worthlessness, excessive guilt, and recurrent thoughts of death. Virginia's suicide ideations are vocalized in the novel she writes and ultimately when she takes her own life at the creek. Virginia's social functioning was noticeably impaired through her unique interactions with her sister Vanessa and Vanessa's children. She placed a large amount of pressure on her sister to include her in everyday activities like attending a lunch in London. Her antisocial behavior was off-putting to strangers, which kept her from that. For example, she one-sidedly kissed her sister passionately on the mouth, ending a visit pretty uncomfortably. She was also short-tempered and demanding with the servants, like demanding her kitchen servant to go to London to get ginger for her sister's children at the last minute. It's also important to note the symptoms we don't see, which in Virginia's case are manic episodes with irritable mood or mixed episodes. Oftentimes she appeared weak and so depressed that it seemed like she would waste away. The DSM-5 also attributes similar symptoms to major depressive disorder to a significant loss or bereavement or intense sadness. Mistakenly, these would resemble major depressive disorder. However, because Virginia's symptoms have persisted all throughout her life, I still consider my initial diagnosis accurate. These symptoms would have to persist for more than just a year. Though the DSM-5 suggests that this diagnosis could resemble aspects of schizophrenia, I would conclude that Virginia does not meet enough of the criteria to substantiate a true diagnosis. She never seemed to admit to hallucinating images, nor did she display any violent outbursts. However, she did hear voices in her head that eventually gave life to the novels that she wrote. To consider all options and reference the differential diagnosis from the DSM-5, I also think it's important to note that her depression could possibly be related to another underlying medical condition not yet discovered. Her husband reports her to have been suffered from moods, blackouts, and lack of desire to live. She often admitted to feeling like a prisoner in her own body. Medication could also be blamed for symptoms mirroring depression, possibly attention deficit or hyperactivity disorder, maybe adjustment disorder with a depressed mood, or simply periods of sadness as part of the human life cycle. While all these reasons are potentially possible to rule out my diagnosis, many of these are not applicable, nor do these apply to Virginia's specific situation. Virginia was never forthcoming on taking any medication that may have replicated such symptoms. She never really seemed to display symptoms of ADD, and she didn't seem to have trouble focusing on one task, as she often wrote alone in her room. The last symptom I'm assured we do not see is comorbidity, a disorder that partners with major depressive disorder and has partners with panic disorder, obsessive compulsive disorder, anorexia, bulimia, and border personality disorder. Virginia didn't seem to display any of those disorders. The severity of her symptoms and desire for death was far greater than any normal periods of sadness in the human life cycle that is really expected for any human to experience years of sadness. I understand the benefit of keeping in mind reasonable doubt to allow other potential diagnoses and discoveries to be made. Lastly, I have narrowed down potential treatments Virginia Woolf could have benefited from had she not taken her own life at so early on. The first would be a psychopharmacological treatment. I researched a variety of options, but nothing came back with 100% effectiveness. Most psychopharmacological treatments targeted to redress the suicide risk rather than the overall depression disorder. However, in the last several years, there has been research to show that the drug lithium has been proven to reduce the effects of bipolar disorder. It has also been proven to reduce suicidal behavior and cover a major list of major mood disorders. The side effects and drawbacks of lithium when taken in excess could cause death. it is potentially dangerous to provide an at-risk individual with what could potentially be a lethal dose of medicine. I think this is dangerous to give a patient who is contemplating suicide the tools to do so. In addition to this, it must be taken long term and does not completely cure the disorder, but simply manages it. Other possible side effects include sleepiness, weight gain, sexual dysfunction, dry mouth, and blurred vision. To go down a different avenue, I also considered psychological treatments for Virginia, and I settled on the classic cognitive-based therapeutic model. The focus of the sessions would primarily be on improving the client's condition by changing the patient's learned behaviors. In doing this, we would eliminate certain aspects of the client's life while emphasizing other parts, and then later evaluating the effects. For example, Virginia and her sister's children seem to cause Virginia undue stress and anxiety surrounding their visits. To try cognitive-based therapy, perhaps Virginia refrains from seeing them for a month and see if her comfort level rises. Virginia seems to appear most at ease when composing her novel, lost in the world of her characters. Thus, we would increase her writing time and direct more focus on writing in an attempt to block out outside triggers that make her feel sad or suicidal. Some cognitive-based therapies have been reported to be more successful than medication, while also some have been reported to be ineffective. Cognitive-based therapy has its limitations as well as its drawbacks. Cognitive-based therapy might not work if the patient has an internal chemical imbalance that can simply not be improved with therapy alone. In Virginia's case, while I recognize that therapy would benefit her situation, I doubt it would be enough from ultimately dissuade her from ultimately committing suicide. Third, I considered family therapy as a possible treatment option for Virginia because I feel it's important to include her husband and her family as part of the healing process, as well as alleviate some of the tension placed on him for caring for someone with such stressful symptoms. I also think a very important aspect of family therapy is psychoeducation. To begin with, I would offer some education for her husband and her sister on major depressive disorder, specifically the symptoms to look out for, specific causes for concern, and maybe how to administer a short risk assessment checklist to determine if Virginia is ever in immediate danger or a danger to herself when contemplating suicide. I would also educate her family on the benefits of antidepressant medications and also the risks, as they are the ones who will be watching out for her. Also, I would recommend that they educate themselves on the medications that she's taking and the potential lethal dose. Lastly, I would give each family member the opportunity in a safe environment to direct a message towards Virginia, expressing their concerns and desires to encourage her internal will to live. In the movie The Hours, her husband's frustrated plea with her while sitting at the train station, begging her to choose life, showed that she was deeply affected by the love her husband showed her. As a family therapist, I hope that the concern her family shows inspires her to follow treatment instructions. Maybe this would help reach her internally. The drawback to this intervention is that it requires cooperation from family members who might be struggling to accept Virginia's condition. In this case, I think her sister might potentially have trouble communicating with her. In addition to this, there are also conflicting concerns about the effectiveness of doing just this intervention alone. Again, I would pair this intervention with a pharmacological treatment such as tricyclic antidepressants or lithium. I think that all medical treatment should be accompanied with family therapy. Lastly, I researched biomedical treatments as a possible option for Virginia, but according to research, this type of treatment is usually reserved as a last resort due to the severity of the therapy. ECT, or electroconvulsive treatment, is designed for major cases of depression and administers low doses of electric shock to the patient's brain while being mildly sedated. Ironically, this treatment existed already during Virginia's time period, but it was a much more violent and archaic version, and it would physically hurt the patient, sending sharp pains of electric current through the patient's brain. Today, however, the treatment has been toned down to target symptoms like major depression, sleep disorders, eating disorders, and delusion. It has an effectiveness percentage of 60 to 90% improvement in its patients and is known to work quickly and efficiently. However, the drawbacks to this intervention are the severity and unpredictability of the treatment's reaction to the client. I also think that the action itself would be traumatic to the client. I don't think I would consider this treatment without confirmation from several other therapists that it would be guaranteed to best serve the client. Overall, the interventions I propose that would best help Virginia's particular situation would be the psychopharmacological treatment of medication, in addition to the psychological cognitive-based therapeutic model. However, it would also include family therapy in there as well, because I wouldn't want to forget her sister or her husband getting the psychoeducation that he needs. I truly believe that Virginia's suicide may have been preventable had she taken antidepressants and received weekly therapy to monitor her mood swings, depression, and suicide ideations. I also think family therapy would have been a great benefit for her husband, as he dedicated his life to supporting Virginia's well-being, moving them from London to the countryside and starting a printing press. As a potential therapist looking at this case, I feel confident after reviewing the criteria in the DSM-5 and closely examining the symptoms in the movie The Hours, as well as reading her biography, that the symptoms Virginia Woolf suffered in that time period of her life was major depression disorder. I think that it may have morphed into bipolar disorder as she grew older and eventually taking her own life. I've attached my references on the sheet, and this was my first video to upload to YouTube, so thank you.